morning, ma'am. I am Isojan Weska from BSN 2A, and I am here to demonstrate to you the bag technique. So bag technique, it is a tool by which the nurse, during her visit, perform nursing procedure with ease and deftness to save time and effort with the end view of rendering effective nursing care to the client.
Step number 1. Assess the completeness, neatness, and availability of bag content with proper arrangement in order to be well prepared and to give complete care to the client. Step number 2. Determine the needs of the client on basis of findings during the home visit, in order to take out necessary materials needed in the care of patient. Step number 3. Upon arrival at client's home, place the bag on the client's table or any flat surface lined with paper lining. The clean side must be out and the folded part touching the table. This to protect the bag from getting contaminated. Step number 4. Ask for a basin of clean water and place this outside the work area in order to be used for hand washing. Step number 5. Open the bag with handle tucked at the bottom of the bag. Take out the plastic lining and spread on the top of the paper lining in order to protect the paper lining from getting wet. Next step is take out the hand towel, soap dish, and apron. Place them on one corner of the work area in order to prepare for hand washing. Next step is to do hand washing. This to prevent infection from the care provider to the client. After that, we have to wipe dry with hand towel. Next step is to put on the apron with right side out and wrong side touching the body. It is to protect the nurse's uniform. Step number 9. Take out things that will be mostly needed for a particular case and place in one corner of the work field. It is to have them readily accessible. Step number 10. Place waste paper bag outside work area. The next step is we have to close the bag to prevent contamination. Step number 12. We have to proceed to the specific nursing treatment. It is to give a comfort and security in haste and recovery of the client. After nursing care and treatment, clean and sanitize equipment used. Discard used materials properly. Next step is we have to do hand washing in order to protect the caregiver and prevent infection. Then we have to wipe dry with hand towel. number 15. Open the bag and return the clean materials in its proper places. Step number 16. Remove apron and fold it away from the body with the soiled or dirty side in and clean side out. Then we have to place it back in the bag. Step number 17. Fold the plastic lining top side in and place it inside the bag. Next, we have to fold the paper lining with the bottom side in and place it inside the bag. After which, we have to close the bag. Step number 18. Document data, observations, and care done. Next, we have to give health checks as needed, and we have to make appointment for next visit for follow-up care.